season, it often peaks this time of year, so we need to know what to do to stay healthy and away from all of that. What do you do if someone in your household is sick? And how do you prevent it from spreading through the rest of the household? Well, joining us today to talk about flu and respiratory illnesses is Dr. Cynthia Snyder, Cone Health Infection Prevention Medical Director. All right, so to start, where are we currently with the flu numbers? Because it seems like everybody I know knows someone who's had the flu.
Yes, I agree that the numbers are still pretty high in our community, and I don't think we have peaked. The CDC did release some data about 10 days ago, and since the freeze, we still know that the data suggests that those numbers are still increasing. Within our health system, of pediatric cases that were tested, 60% are positive, and with adults, it's about 40%. So if you have like fevers, cough, and just feel very fatigued, all those are pretty consistent with flu symptoms.
Yes, I'm hearing all kinds of people having it. They're stopping kinds of travel because people from somewhere else already have it. So if someone has not gotten the flu shot yet, is it too late to get it, and why does it still matter?
It still matters. It's not too late. We don't think we're going to peak yet. Still have a few more weeks until we hit that apex of this flu season, and it takes about 7 to 10 days to get full immunity. And I feel like it's still important because not many people took the flu vaccine this winter. So especially if somebody has other health conditions such as heart disease, especially lung disease, that makes you more primed to having complications of flu. And we just want to protect everybody so that they don't have to be hospitalized or more severe infections with it.
Okay, so let's talk about the differences between the flu and other respiratory illnesses like COVID or RSV, both of those also in our community as well.
Correct. I would say in the past few weeks, the RSV numbers have been trending down. It's generally it peaks about now and starts trending down, so it's more likely to be influenza at this stage. This winter is the first winter since 2020 that we haven't had a massive COVID wave. And I think that's part of having multiple seasons of COVID. Our immunity is primed. We had a large COVID wave in the fall, and I think that's been protective. Only about 3 to 5% of our COVID tests are positive. So in fact, now it's more likely just to be a cold.
Okay, so flu is it at the moment. If someone starts feeling flu-like symptoms, and let's talk about what those symptoms are, let's then talk about also what steps they should take.
I'm sorry, can you say that again?
The flu-like symptoms, what are they and what steps should we take?
Yes, so flu-like symptoms are those, comes on quite quickly. I think people feel that they can have some nasal congestion, but also fevers. They feel like bone aches, muscle aches, very fatigued, and probably and having cough as well.
Okay, and so if they have those kinds of symptoms, like what should they do?
We would recommend, the recommendations vary. So if somebody is otherwise healthy, I would just stay home, stay hydrated, take some medicines to keep your fever down, and stay home and not go back to work and potentially put others at risk for getting influenza. For kids and adults who have health issues, it's important to be seen by either a primary care provider. You can do a telehealth visit, and also potentially urgent care to be evaluated, especially if it comes to being short of breath, or if you're noticing to the fact that you're not able to do your day-to-day activity. It's important to be evaluated. The one thing that's really important this season is that there is an over-the-counter flu and COVID combined test that you can find at pharmacies that is pretty accurate and very useful.
Okay, so here's the thing. I've heard lots of people say, well, so-and-so has the flu, but the rest of us so far haven't gotten it yet. And they're all living in the same house. How does a family prevent spreading the flu within the household?
That is a great question, and sometimes it's challenging to do. So the key thing is that the person that's sick, if they are joining the rest of the family, it's that old school of wearing a mask, making sure proper hand hygiene and cough etiquette. I think for children, it's tough. Parents are always going to just be caring for them, and they may still be exposed and possibly get sick. I think for patients who have like heart disease or lung disease or even who are immunocompromised, it's best to contact their primary care doctor to see if they need to take medicines as prophylaxis to prevent getting flu.
Okay. All right. So what we're going to do, we're going to take a quick break. We've got a few more questions to ask about all of this flu coming up right after the break.